Hi everyone, I'm CJ Tobe, the Director of Community Health at Desert AIDS Project. I moved to the desert 5 years ago this summer to work at DAP. Many of you listening already know about the compassionate healthcare services DAP has to offer. What some of you may not know is that these services are not only available for those living with HIV, but are also available to those who are HIV negative who want primary care, dental, and behavioral health services. I get asked all the time, what is the community health department? What does the department do? Every time I'm asked these questions, my responses always vary, as the community health department is constantly adapting programs to address the needs of our wonderful community. And this could not be any more evident than the innovation the community health department has done through the COVID-19 pandemic. Let's talk about community health programming. Education. Knowledge is power. We provide education on HIV, hepatitis C, the game-changing medication in HIV prevention called PrEP, sexually transmitted infections, STIs are also known as STDs, overall sexual health education, and now education to limit exposure to COVID-19. Our community health educators present to our future, the youth in schools across Riverside County. We collaborate or support many organizations that help provide services to our youth in the Coachella Valley. Our health educators also present to over 30 recovery centers and treatment facilities across Riverside County, from as far west as the city of Riverside to as far east as Blythe. Presentations at jails and detention centers. Our educators create a safe space, judgment-free zone for people to share and learn from one another's experiences, to provide information to help people make the most informed decision they can in their life. Also, we offer education to outside clinics, such as primary care doctor offices, urgent cares, and more. So the next program within the Community Health Department is our testing program. Know your status. Whether it be for HIV, hepatitis C, or STIs, knowing your status is key to your overall health and to prevent transmission to others. For me, testing is empowering. Knowing my status benefits me, but it also benefits the community. Our community health testing team attends over 70 community events throughout the year. Health fairs, pride festivals, we're on Arena Street, we're at men's resorts, we're at youth summits, and so much more. I'm sure you have seen many of them in bright orange gear that says Get Tested Coachella Valley, or the branded Get Tested mobile van. Get Tested Coachella Valley launched in 2014 and is a region-wide public health program dedicated to dramatically reducing HIV by making voluntary HIV testing a standard and routine medical practice and ensuring linkage to care. The Get Tested campaign is how the Community Health Department became into existence. The focus of the campaign was to test and make as many people aware of their HIV status as possible. In present day, 2020, our data has led us to adjust our testing strategies to focus on testing a few of our priority populations. Priority populations is the populations most at risk of HIV. Poverty has been identified as a major driver in new HIV infections in the Coachella Valley. In calendar year 2019, over 50% of the new HIV cases tested at DAP were people who were living in poverty. The county, state, national, and global data of new HIV infections shows us that our communities of color are disproportionately affected by HIV. This has led to an increase in HIV testing in our communities of color at organizations that serve our homeless neighbors and different homeless encampments across the Coachella Valley. The data still shows that the highest risk factor is MSM, which stands for men who have sex with men, and thus our testing resources within the Community Health Department have also been allocated there. So what about testing at Desert AIDS Project, the sexual health clinic called the DAP? The Community Health Department provides HIV, hepatitis C, and STI testing here on site as well. We recommend calling to schedule an appointment at 760-992-0492. We are here for your sexual health needs. So what happens if somebody tests positive for HIV? Or what if someone's living with HIV and they fall out of care? They stop seeing their doctor, they stop taking medication. Well, at Desert AIDS Project within the Community Health Department, we have a linkage to care team or an early intervention services team, also known as EIS. This is the program that links all new HIV clients or clients who have fallen out of care to medical care to begin or restart HIV medications. The EIS program meets with the clients, completes an acuity to assess a client's barriers that's preventing them from attending medical appointments and adhering to HIV treatment. Some barriers our clients face include homelessness, mental health, substance use, transportation, food, and more. The EIS program and their clients tackle these barriers together to support their client in their journey of living with HIV. The EIS program is crucial as they work with their clients to achieve a status of undetectable. As some of us know, undetectable equals untransmittable. U equals U. Meaning that people living with HIV who are adherent to their HIV medications have a virally suppressed viral load, which means they are undetectable and therefore cannot transmit HIV to another person. So undetectable equals untransmittable. U equals U. According to Dr. Anthony Fauci, when he was interviewed at the 2019 International AIDS Conference, he stated, "The concept of U equals U is the foundation of being able to end the epidemic. This is what Desert AIDS Project has been striving to do for the last 36 years. U equals U has helped combat stigma of those living with HIV, as people are becoming aware of U equals U and they are choosing fact over fear." The EIS program does not only support our clients living with HIV, but also assist in the same way with any new hepatitis C case or people who have been previously diagnosed with hepatitis C, but have not completed treatment. The EIS team will assist and support the hepatitis C clients through their journey while they receive medical care in our Hepatitis C Center of Excellence until they cure the hepatitis C virus through medications. And yes, I said cure the virus because hepatitis C does have a cure. So let's put PrEP in our step and talk about the next community health program known as our PrEP program. I'm sure many of you have heard of the game-changing medications to prevent HIV called PrEP. PrEP stands for pre-exposure prophylaxis and is a pill, it can be Truvada or Descovy, that is taken to prevent someone who is HIV negative from acquiring HIV. Similar to birth control, PrEP is a medication that is taken once a day. If taken once a day, PrEP has been shown to be 99% effective in preventing HIV infection. The PrEP navigators within the community health department follow a case management model where they share information with their clients pertaining to PrEP, navigate them through insurance needs, assist them with covering the cost of PrEP care, which include office visits, lab work, and the medication itself. While the medication does carry a high price tag, there are many support programs to help offset the cost, and most people can access PrEP with very little or no expense. And this is what PrEP navigators assist their clients with. These programs are the foundation of the community health department and help to explain some of the amazing work the community health department does for our community. I've spoken with many colleagues in public health regarding the COVID-19 pandemic, and many expressed their concerns surrounding the impact it would have on the HIV epidemic. Someone mentioned to me that this pandemic is going to set HIV prevention back years. In late March, as the COVID-19 pandemic began sending waves across the country, DAP had an unprecedented 7 new HIV cases. I immediately began dialogue with people around DAP on ways we could create COVID-19 specific programs while simultaneously adapting the way we deliver existing services to ensure that we are keeping our finger on the pulse of the HIV epidemic. Our motto in the community health department for the last several months has been, because we are faced with the COVID-19 pandemic does not mean that we lose focus of the HIV epidemic that we've been battling for over 35 years. DAP, but specifically the ways the community health department has turned a crisis into innovation, is that we now offer at-home HIV test kits to people who want to know their status but are afraid to leave their home for fear of COVID-19. We moved our STI testing services outside of our sexual health clinic into the DAP parking lot where patients could complete STI testing out of our mobile unit to reduce COVID-19 exposure. The EIS program implemented an essential food delivery program to deliver our items to our most vulnerable patients' homes to reduce exposure to COVID-19. This also includes delivering medications to a patient's home if the patient cannot wait for their pharmacy to mail them out. The PrEP program is virtually enrolling their clients into all patient assistance programs. The EIS program is virtually enrolling new patients into all of DAP's clinical services. Presentations are still happening via Zoom through teachers distributing them to their students and to recovery centers and treatment facilities. Community health staff are also supporting other areas around DAP, including providing rapid asymptomatic COVID-19 testing in DAP's COVID-19 triage clinic. Community health staff are also helping support with the high volume of calls that are coming in for people wanting to get tested for COVID-19. The community health staff are also assisting with screening patients as they enter the buildings to ensure that nobody is symptomatic for COVID-19. I'm so grateful to work at an organization such as Desert AIDS Project, whose mission is to enhance and promote the health and well-being of our community, and DAP has been doing this for 36 years. I'm also grateful to be leading the community health department as I'm surrounded by compassionate, collaborative people who have been doing amazing things to help support our community before the COVID crisis and now during the COVID crisis to ensure that no one in our community slips through the cracks. We will continue to live and lead with compassion and understanding as we don't fully know the privileges that we have nor understand the struggles of others.